really, really big one, and that is anxiety. A nervous type of anxiety raises blood pressure because of the release of norepinephrine primarily, but adrenaline, other hormones that cause constriction of the blood vessels. And if you think of what high blood pressure is, it is the blood vessels are constricted. That's what it is. That's why the blood pressure is high, is because the blood vessels are not dilated to let the blood in. And so they're narrow and they're stiff, so they have very low blood flow. And because you have low blood flow, then you have to raise the blood pressure to get more blood through those stiff vessels because they're not dilated and open.
We got it. All right. Hello, guys. Welcome to the Healthy Heart webinar. We're getting this started here. We're going live on Facebook. YouTubers, hello. Welcome to the show. Today we have the one and only Dr. Scott. What's your middle initial? Scott M? No.
D. D is in David.
Scott.
D is in dog.
Okay. Scott D. Saunders. Okay, that's good. Because I don't think the other Dr. Scott Saunders probably has the same middle initial. So I can say the one and only Scott D. Saunders, right?
Yeah, I suppose.
Okay. No. MD.
Yeah,
I don't know.
great.
Maybe he is. All right. Anyway, guys, welcome again. Like always, say hello in the chat. Let us know where you're tuning in from. Facebook friends, you can do that right there in the comments. YouTubers, you too. So we have a great show prepared for you today. We are going to be chatting about, well, first of all, this is the Healthy Heart webinar. So the goal of this webinar is for us to learn how to better take care of our heart, how to reverse heart disease, how to prevent heart disease really is a big part of it as well. And so we're going to do some teaching. I won't, Dr. Saunders will, and then we'll open it up for some questions from you. So feel free to post those questions, those of you in Zoom, in the Q&A. This is a free webinar. So if you're not watching it on Zoom, I'd really recommend you do it there. Register for it at bartonwebinar.com. Then you can be a part of the actual live Zoom session where you can post in the Q&A and do all of that. So anyway, we're going to be talking about high blood pressure today. And we're going to talk about the effects that high blood pressure has on sleep and the effects that sleep has on high blood pressure. And so this is going to be really good. And I'm excited to chat about this. In fact, we were right before this, I was just talking with Dr. Saunders about my middle schooler who stays up way too late and just thinking through some of the problems that itself can create in the body. I know what happens.
Is he watching?
No.
Is he watching this webinar?
He's going, no. He's in school, but he'll be so excited that I'm talking about him. But I know for myself, if I do not get enough sleep, oh boy, guys, lots and lots of problems. So I'm excited. I'm excited to talk about this. But before we do that, just a quick disclaimer, Dr. Saunders is not your doctor. Please discuss any of these things with your healthcare provider before you do them. And the information that we're giving is also just kind of for general purposes. Okay. So with that, we're going to go ahead and get started. Hello, Facebook viewers. Ginger is here from San Jose with great reports from her doctor. Hey, nice. That's awesome. Oh, wow. We got lots of people. Esther's back. Hello. Great Scott, she says. Terry's here. Jean. I think it's Blessed. If I remember, is your first name Blessed? It says Blessek on here, but I'm pretty sure it was Blessed last time. So we'll see. Let me see. We have Canadians in the house. Nick. Hello. Oh, the one and only Leslie P and Scott D. Okay. Well, my middle initial's M, so we'll say Leslie M. Okay. Larry's back. Eric, ahoy from Minnesota. Howdy from Texas, Dorothy. Ryan Kelly's in the house. Anders is in the house. It is blessed or blessed. Awesome. I knew it. See, I'm getting to know all you guys. That's what happens. Start to know you. So if you're not here, expect a phone call next week. I'm just
Hey, I didn't see you on the webinar.
Why weren't you there? You missed your free webinar.
Yeah.
Okay, Janet is here from Georgia. Rita is here from Lawrence, Kansas. You know what? I was just there a couple of weeks ago, actually. Beautiful place. Okay, let's get this party started, Dr. Saunders. Oh my goodness. Okay, first of all, Tell me what is happening in your body when someone says you have high blood pressure. What's happening?
Well, as soon as someone says you have high blood pressure, then your blood pressure goes up. And that's what's happening in your body. Your blood vessels constrict. Okay, so high blood pressure is not a problem. So it's not a diagnosis. It's not an illness. It's not a health problem. It's not a sickness. It's just a symptom. Okay, so like pain, like my thumb hurts, is not a health problem, and it's not an illness. My thumb hurts. You would have to say that the next question is the easy question, and that is, why does your thumb hurt? Oh, because I hit it with a hammer yesterday. Well, okay, now you have a reason why your thumb hurts. Blood pressure is the same thing. It's not an illness, it's just a symptom. So anytime someone says your blood pressure is high, your next question is, why is my blood pressure high? And if you look up, I looked it up once on wrongdiagnosis.com, how many different illnesses are associated with high blood pressure? There were over 300 different reasons why your blood pressure might be elevated. And, just off the top of my head, there's hormonal reasons and all kinds of hormones, your adrenal glands, your thyroid gland, your sex hormones. And there's several different adrenal hormones. It could be an aldosterone problem or a cortisol problem, adrenaline, epinephrine, norepinephrine, and it could be a pituitary problem. So these are all hormone problems, and that's just one area. And then there's toxic problems, all kinds of toxicities that can raise your blood pressure. Lead toxicity, mercury toxicity, heavy metals, organic toxins that raise your blood pressure, cause vasoconstriction. And then there's autoimmune diseases that raise your blood pressure. All these autoimmune, myasthenia gravis and various autoimmune diseases cause high blood pressure. Inflammatory conditions that are not autoimmune, having extra inflammation in your body raises your blood pressure. And then there's deficiencies. If you don't have enough magnesium or potassium, your blood pressure goes up. And guess what a very common one is? A lack of sodium. What the heck? What's that? Well, what happens is, a lack of dehydration. Your blood vessels constrict when there's not enough electrolytes around. You've got to have those electrolytes, especially potassium. And potassium isn't something you can just measure. So magnesium, if you don't have enough magnesium, you get vasoconstriction and you can't relax those muscles. So your blood pressure goes up. So gosh, off the top of my head, did I get to 300 yet? There are a lot of different reasons why your blood pressure can be elevated. So what happens when you go into a doctor's office and the doctor says, your blood pressure is high? What's the next step?
Well, the scary part is I know a lot of people are on high blood pressure meds.
Yeah, that's right. So here's a medication for your blood pressure. Well, but nobody asked the question. Why didn't the patient, or at least the doctor, ask the question, why? Which of those reasons? So for example, if your magnesium is low, taking a diuretic, isn't going to help. It's going to make it worse. So that's not going to be helpful. What if it's a toxin and you just got to get the lead out, and they give you an ACE inhibitor? That's not going to work. And very often that's the case. So when it doesn't work, what does the doctor do? You go back and you said, gosh, blood pressure's still high. Medication's not working. Now what? Oh, here, take another one. And then you go off and it's not working. You come back and you go, gosh, it's not working. What do I do? Here, take another one. So now you're on 3 blood pressure medications and it's still not working. I had somebody yesterday came into my office and he said, well, I want to get off these blood pressure medications. I said, well, do they work? He said, well, no. Do they lower your blood pressure? Well, no. Well, then why are you taking them? Well, because the doctor told me to take them. And I said, if they're not doing what they're supposed to be doing, then does it make sense to take it? Well, no, it doesn't make sense. But that's what the doctor said, take it anyway, even though it's not working. So so then what we're doing, because it was just yesterday, so what we're doing is we're testing. We have 300 things to test for. Does he have a magnesium deficiency? Does he have toxicities of some kinds? What about his hormones? So we're doing all these tests on all those kind of things. And there's one really, really big one, and that is anxiety. A nervous type of anxiety raises blood pressure because of the release of norepinephrine primarily, but adrenaline, other hormones that cause constriction of the blood vessels. And if you think of what high blood pressure is, it is the blood vessels are constricted. That's what it is. That's why the blood pressure is high, is because the blood vessels are not dilated to let the blood in. And so they're narrow and they're stiff. So they have very low blood flow. And because you have low blood flow, then you have to raise the blood pressure to get more blood through those stiff vessels, because they're not dilated and open and letting blood in. I don't know if you ever worked with pipes, but if you have a 1/2 inch pipe, or let's say a garden hose, a 1/2 inch garden hose is only going to get you so much water. If you really want to water your plants, you need the 3/4 inch, 5/8 size hose to get a lot of water through there, so your sprinkler works well. Same kind of thing, it's just fluid mechanics. If you have narrow blood vessels, then you're not going to get as much flow unless you raise the blood pressure. So then your body's not getting enough flow, and it tells the heart, hey, we need some pressure here, or we need extra flow. So then the pressure goes up to increase the flow. So if you can get the blood vessels to relax, and that's where people talk about, like, well, do meditation and find relaxation exercises and find a way to dilate those blood vessels. If you've ever heard of the Wim Hof method, it's a very interesting. He's the Iceman. He's the guy that. What did he go up like? It wasn't Everest. It was like one of the big mountains anyway, in like a t-shirt, or no, he didn't even have a shirt on, just had shorts and boots, and that's all he wore to the top of the mountain. Anyway, so but he teaches people how to use their parasympathetic nervous system, and that's the opposite of anxiety. Anxiety is the sympathetic nervous system. The parasympathetic is what is the balancing of that sympathetic. So if you have high sympathetic, what you need is parasympathetic to balance it, so that your blood vessels will be normal and your blood pressure is normal and all that. So that's the important thing. So that's all. So there's so many things that could be going on with high blood pressure that we can't just assess one of them or assess all of them with, in 1 hour.
Right. We did have someone who was asking some questions about sleep and the effect that it has on high blood pressure. And so that's kind of what the reason that we're going to touch on some of this. Let's talk a little bit about that. Boy, it seems like sleep is sure important for a lot of things. Why would that matter in the case of blood pressure?
Okay, so you have the issue of stress. You have these stress hormones. And when you're really tired, and you kind of push through and then you finally get a second wind. You know what the second wind is? It's adrenaline and cortisol. And what does that do? Well, vasoconstriction. It raises your blood pressure, makes your heart beat harder. You can actually feel your heart beating. Some people wake up with an adrenaline rush and their heart beating hard, and they're like, "Oh no, I'm and then they can't get back to sleep. And then if they check their blood pressure, they're like, oh my gosh, my blood pressure was 150 over 90. I'm going to die any minute now. And that's not the case, but sleep is really important. So pushing through when you're tired, and when you're tired, go to sleep. Go to sleep early. It's actually better to go to sleep early in the evening. That way you can get anabolic, you can get the cortisol levels low, so that your human growth hormone levels can go up, and you can become anabolic, and the blood pressure, your blood vessels dilate, and everything repairs. So sleep, if you don't sleep well, your blood pressure will go up just for that, for no other reason. just because you're not sleeping. That's one of the 300 things. So if you go in and you're not sleeping well, and the doctor gives you a diuretic, and the diuretic makes you pee all night, so now you're not sleeping, then your blood pressure goes up. And it's because of the pill that you're taking that your blood pressure is going up, and it's supposed to lower your blood pressure. So that's why it's not about the pill. It's not that the pills are bad. I have people on blood pressure medications, but they're on the medications because that medication deals with their problem. So if somebody has a problem with the kidneys and a renin-angiotensin system, then I can put them on an ARB, angiotensin receptor blocker or something, so that their blood pressure will come down to normal, and then they won't have those issues with their kidney. So there are reasons to be on a blood pressure medication, but not just randomly. You have to find out what your problem is and then pick the right one or medication if that's what it is, or fix the problem and not have it. So if you can't sleep at night, then you got to get sleep before you even deal with the blood pressure. Your blood pressure is high just because you're not sleeping.
Here's a question here from Krish. Welcome back, Krish. What is normal blood pressure? Is there a range? Is the American Heart Association recommendation acceptable? Good question.
Oh, that is so good. That's a great question. So if you look at a graph of, and I actually had some graphs I usually show to my patients, of your mortality rate versus the blood pressure. The optimum blood pressure for somebody over 65, now we'll get to the younger people later, let's start with over 65, is actually 75, so it would be like 70 to 80, over 140, 75 over 140, that's the optimum blood pressure for somebody who's over 65. Now, if you're younger, then the blood pressure is actually better at your survival, your longevity is better if your blood pressure is 120. So why would you be 140 at 65 and 120 at 35? Well, because of, we were talking about blood vessel compliance. So as we age, the compliance of our blood vessels tends to decrease. And that's hardening of the arteries, it's scar tissue, it's whatever reason, we're all different in that way. So the arteries tend to be not as compliant. And so you need more blood pressure to get that blood to the peripheral tissues. Whereas when you're younger, you have really good compliance. So when the heart beats, the blood vessels relax, the arteries relax. And then when the heart relaxes, the arteries constrict and push the blood through. So you have this kind of a thing going on all the time. And so you don't need as much pressure because the arteries are helping. As we age, the arteries aren't helping as much. So the pressure needs to be elevated to get the blood to all the distant places where it needs to go. So the optimum blood pressure when you're younger is 120 over 80, 120 over 75 is actually the optimum. And then as you age, the diastolic, the lower number doesn't change, but the upper number clearly does. So, between 140 to 150 is the optimum range for older people over 65.
Okay, that's good. Rita said that's good to know. My normal is different as I get older. That is good to know. Jean said that I'm finding my biggest problem about getting the right amount of sleep is trying to get to sleep and not waking up in the middle of the night looking for something to eat, which I know is wrong. Why is that? Why do so many people want to eat in the middle of the night or drink?
Well, part of the reason, okay, there's two things going on. Let's talk about the eating first, because that was mentioned. After you eat, especially like type 2 diabetes, after you eat dinner, and then your stomach's emptying out and your blood glucose is high. And then what happens at nighttime is the blood glucose starts dropping low. Now, people that don't have diabetes, people that have a normal metabolism function, that as their blood glucose drops down, there's two things that happens. One is they release glucagon that tells their liver, make some more glucose. And they start switching to fat burning metabolism really easily. And so while they're asleep, they don't even notice it. They just sail through that transition really easily. But if you take somebody that has like type 2, where their insulin levels really high because they're insulin resistant, now with the high insulin, they're not going to make glucagon because for the pancreatic islet cells, it's either or. Either you're making glucagon or insulin, not both. So the cells that are making insulin, they're not making glucagon. So what happens? Your blood sugar just keeps going down and down. Insulin's still high, and the blood sugar is just dropping low. So then you get up, you wake up at night, and you go, man, I got to eat something. I'm feeling really hungry. And it's because your blood sugar is dropping low. Sure. Now, in type 2, a lot of that is relative. So if your blood glucose is always 200, or if you're in Canada, it's like always 7 or 6 or 7, it's always up there. And then it drops down to a normal range, like 100, which would be normal for everybody else. All of a sudden, that's like half the blood sugar. And you're used to having this much, and now you only have this much. And so you're relatively hypoglycemic. And so you'll still wake up and go, oh my gosh, I'm really hungry. I got to eat something. And yeah, what you said is absolutely right. I know that's not right, but I just wake up and I'm so hungry. Well, that may be one reason why. Now, the other thing you mentioned is drinking. Now, that's a totally different thing. And that's where the blood pressure, this thing that we're talking about, blood pressure comes in. And that is the blood pressure, the blood vessels are relaxed. They get more and more relaxed at night, get more parasympathetic stimulation, less sympathetic. So the blood vessels are relaxed. The dilated blood vessels make you feel warm. So if you've ever had like flushed, like you're embarrassed or something, and your cheeks get hot, the reason they get hot because the blood vessels dilate. So you wake up, and as you warm up, your blood vessels are dilated, and then you don't have as much blood volume to maintain that the amount of dilation. You don't have enough blood volume, so you feel thirsty. It's automatic. It's just part of the system. So it's kind of normal.
Wow, very interesting. Okay, so I want to talk about a couple more things. Let's go through maybe some things that we can do to get better sleep at night. What would you recommend?
Okay, excellent question. So I actually yesterday was talking to someone about this extensively, because she said, I've been through everything. I've tried everything and nothing works. So, and one of the things she said about not working is that if she drinks alcohol, it'll knock her out at night, but she doesn't get good sleep. She wakes up in the middle of the night. She just doesn't feel rested the next day. And then the same thing happened with the sleeping pills that she took. So she took Xanax, and she's tried all of them, Belsomra, all of them, Ambien. And she said that, they'll knock me out, but in the morning I feel groggy. I'm not rested. And I'm like, yeah, pretty much all of those things, all of the sleeping pills tend to decrease your deep sleep. So you actually don't get good sleep, good restful sleep. Restorative sleep is what you're missing when you use a sleeping pill. Now, there are a couple of sleeping pills that actually don't do that. One of them is called melatonin. Melatonin is a hormone, and it's the sleep hormone. And most hormones, if you take the hormone, if I gave you cortisol, it shuts down your adrenal glands. And it may take a while for those adrenal glands to turn on again if you take that cortisone pills for a long period of time. Whereas with the pineal gland that makes melatonin, it's not affected by the amount of melatonin you take. So melatonin is actually found in food. It's made by other cells in your body, like your enterocytes, the cells that line your intestines. There are other sources of melatonin in your body besides just the pineal gland. So interesting about the enterocytes, if you have inflammatory bowel disease, you often have sleep issues because you don't make enough melatonin because those cells are inflamed and they don't make melatonin. They're missing several other enzymes too, usually. So the two things, one was melatonin, the other one is antihistamines. Antihistamines have been used for many years. They're safe and effective. They work well. If you look at all of the antihistamines, the Tylenol PM, the Advil PM, the Unisom, Sleep Ease, et cetera, all those sleeping pills, they're all antihistamines. They're different types of antihistamines, but they're all antihistamines. They do actually give you good sleep, restful sleep, the restorative sleep. You get the deep sleep with it. It doesn't shut that down. However, gosh, every rose has to have.
I was going to say, is he just going to leave it there? Because I feel like he's not.
Every rose has its thorn. So the problem with using those long term, now if you use them occasionally, that's fine. But if you use them long term, they inhibit something called acetylcholine, which is necessary for your memory. And so if you inhibit acetylcholine, then you lose memory and you end up over years with dementia or dementia-like symptoms. And that study's been done, and that actually is a thing that really does happen. And so the doctors will say, well, you should never take antihistamine sleeping pills. Here, take Ambien. And it's like, I'm rolling my eyes because the Ambien's worse in many ways than the antihistamines, than the Sleep Ease, Unisom, or I've had a lot of people like Advil PM. That's what I take every night, Advil PM.
Interesting. Terry actually says the magnesium spray really helps me. How about magnesium?
Okay, so we've been talking about pills. Now, what kind of natural things can you do? And that's magnesium is an excellent way to relax. So we talked about magnesium causing high blood pressure, right? Lack of magnesium, a deficiency of magnesium can increase your blood pressure. Why? Because it doesn't allow you to relax your blood vessels. Magnesium is a muscle relaxant. It's the only muscle relaxant that works on the muscles. So if any of you have ever had an injection of magnesium, I used to do this. People with migraine headaches, we were in the emergency department at UCLA, and we would give magnesium injections. People come in with migraine headaches, and we would just give them an IV push magnesium, and they would flush. They would turn bright red, and they'd go, "Oh my gosh, I'm in an oven. This is crazy." But the headache would go away. Like by the time the flush wore off in like 30 seconds to a minute, the headache was gone, and it doesn't come back because it just relaxes all the blood vessels. And so the blood is restored to flow to the head, so it doesn't hurt anymore. The throbbing goes away, all that goes away. And the blood pressure drops down. You can get dizziness from it. But we just have them sit there for a little while, and then once they're not dizzy or anything, and the flushing is gone, it takes a minute or two, and then they can get up and walk out, and the headache won't come back. It's really awesome.
They still do that?
No, because they have drugs now. Now, if you go to an ER and say, "I want a magnesium IV push," they go, "Oh, we don't do that anymore. You have to take this."
A cocktail. I've done it.
Yeah, whatever. You've done it. Yeah.
And it has what do you take for allergic reaction type stuff? Benadryl. And I'm telling you, I do not tolerate Benadryl very well. That'll knock me out for days. So anyway,
that's the antihistamine sleeping pills. Yeah. So all of them, Advil PM is Benadryl. It's the same thing.
Interesting.
Yeah. So then there's other thing. Magnesium is a good way to relax too. So the people that get the IV push magnesium, they usually sleep really well that night.
Yeah, I bet.
And then the theanine. Theanine is an amino acid that increases your GABA. GABA is the gamma-aminobutyric acid, and then GABA is what like Xanax and Ativan and all the benzodiazepines work on. And so that's how they cause drowsiness. Well, you can do that naturally. Well, sort of. It allows you to make more GABA. It doesn't stimulate the receptors the way something like Xanax would or Ativan.
Go ahead. I was just going to quick post a link to our magnesium so that you can see it. And guys, you can use code webinar25. It's one word and you will save 25%. Okay, carry on.
Okay, so that's interesting. Our magnesium is a magnesium spray. So you can spray it on your body. It's absorbed through the skin. And it's a more gradual absorption. And the reason for that is, the reason we chose that instead of using a pill is because a lot of people were having diarrhea from the pills and they wanted an alternative, and it was kind of hard to find. So we use this as just, it's an alternative to what you can get in the store for pills. So you can still use pills, magnesium, or you can use this spray. L-theanine is another one. And then there's all kinds of herbs, lemon balm. What were the other ones? Anyway, there's herbal remedies, and there's like teas. You can do sleepy time tea, has a list of them, chamomile and lemon balm. I don't know what else. Calming kinds of things. And they tend to work really well. For people that have excessive adrenal output, there's something called phosphatidylserine, PS. And PS lowers that excessive release of adrenaline and cortisol, and keeps the adrenal glands from releasing a bunch of the stimulating hormones for the sympathetic nervous system, and it allows better sleep. Also, we often don't think of estrogen as a stimulator, but estrogen stimulates, and a lot of women can't sleep when they have high estrogen. And so certain times of their cycle, when the estrogen's high and the progesterone's low, they'll go, I can't sleep. I'm in that time of the month when I can't sleep. Or in going through menopause, often the progesterone will drop significantly more than the estrogen, because the adrenal glands will make estrogen, or they'll make estrogen in the belly fat from testosterone. So women that have estrogen, they want to lower their estrogen. There's something called calcium D-glucarate. It's glucaric acid. The calcium D-glucarate is something that binds to an enzyme in your intestines and prevents you from reabsorbing the estrogen. So it actually improves the estrogen to progesterone ratio. The other thing that I often do with women that have these kinds of sleep issues during menopause is to raise the progesterone. So giving a supplement of progesterone. I test first, of course, to make sure that they have adequate levels or that they're off. And then I'll bring things into balance. And sometimes progesterone's magical. It's just like, wow. How do you know? There's actually a question that I usually ask women if they're going through menopause, if they've ever been pregnant. As to how did you feel during pregnancy? And if they say, I had this one woman, she goes, I love being pregnant. I just want to be pregnant all the time. I want to be a surrogate mom and just be pregnant all the time. That's progesterone. During pregnancy, progesterone goes from like 0.5, it just goes up and up and up and up to like 10,000. It's like a huge increase. It's like, many orders of magnitude more progesterone during pregnancy. Well, that's a relaxer. And some women just feel great with that relaxing hormone. And other women say it's much too much relaxation because it relaxes the intestines and slows it down. So you get nausea because things don't move through your intestines anymore because they're just too relaxed. So that's where morning sickness comes from. It's progesterone. And then breast tenderness and those kinds of things can come up too.
Sure.
So when we're using progesterone for sleep in perimenopausal women, we're just adding a little bit more just to try and balance it. We're not going to give you like the dose that you would have during pregnancy.
Yeah. Interesting. Okay. What was the other thing I was going to ask about? I want to talk a little bit about the 6-10 reset, because I don't know that we've talked a lot about that on this webinar specifically, but let's dig into that and why that may really help improve your sleep.
Okay. So not just improve your sleep, but improve your blood pressure. So if you're going to do anything blindly, do this blindly. Instead of taking a pill for blood pressure blindly, if your blood pressure's up, do this first. And we call it the 6-10 reset. And someone else the other day said it's the 6-10-8. I've been doing the 6-10-8 and it's not working. What that means is no food after 6, go to bed by 10, go to sleep by 10, and then eat breakfast by 8. Why? Well, because that's what allows you to get into the anabolic metabolism. And anabolic metabolism is what happens while you're sleeping, and you're getting, you're repairing everything. Everything in your body repairs. It fixes your brain. It takes all the tau proteins out so you don't get Alzheimer's disease. It fixes your heart. It cleanses all the bad stuff out, takes out the dead cells. All of this is happening while you're sleeping. If you're anabolic, and you only get anabolic if you have an empty stomach. You have to have an empty stomach. You have to go to bed hungry. That's actually an important thing. And then you have to be asleep by 10. This has been studied. I didn't make this up. If you want to blame someone, his name is Sachin Panda. He's the one that did the research, and you can find YouTube's. He's got a ton of videos on YouTube that'll explain how the circadian rhythm works, and that they looked at people who work the swing shift and they don't get anabolic when they're in the evening shift. And they looked at people that work nights and nurses that go, oh, I love working nights because it's the best time and I sleep better during the day, and I'm and it's quieter at night, and I just like the night shift the best. Well, guess what? They don't get anabolic. So anabolic is the repair process. That's how you fix everything. And what by fixing what? Well, your arteries get cleaned out. The toxins get released in your body. You repair all the dead cells. You take out the dead cells and you repair them. All the damage that you did during the day because you were pumping iron and you just tore muscle fibers, they get repaired stronger than they were before. Your bones that you broke, yes, you're making little micro fractures in your bones every day just walking around. And those little microfractures get repaired stronger than they were, but that's only if you're anabolic. So why do people need knee replacements? Well, they wore out. Well, why did they wear out? Because they didn't repair, because they were never anabolic. Why do people get stress fractures in their bones? I had a woman, she stepped off a curb and got a stress fracture in a bone in her foot. So she's in a cast. She goes, what the heck? I just stepped off a curb. What happened? Well, for the last however many years, she's had a little teeny microfracture. It didn't repair. Another one didn't repair. Another one didn't repair. Another one didn't repair. And then finally, there's just not enough strength left in that bone. All she had to do is step off a curb and crack, it broke. And that's why did that happen? Because it didn't repair. So on the one hand, people are telling you, oh, avoid stress. Don't stress anything. That's bad for you. Stress is bad for you. No, it's not bad for you. You need to stress. You need to pump iron. You need to run. You need to step off curbs. You need to walk downstairs. You need to run. You need to stress your body out. But what you need to do then is repair it. And that's where our problems come in, because people are eating all night long and they're not sleeping at night, and they're not waking up in the morning and starting their circadian rhythm properly. So this is the 6-10 reset. And I think I've explained it pretty thoroughly.
Yes. Good. And we have a lot of people that are doing that now and finding great results. People who are even, working toward reversing their type 2 are finding that their numbers are significantly lower in the morning just by going, primarily going to bed on an empty stomach.
I had a woman come in today. She's 70 years old. And she's been they used to call them stewardesses in her day, but now it's flight attendant. So she's a flight attendant like for 30 years. She's retired from being a flight attendant, but she still flies all over the place because she gets free miles. She gets to fly. So I told her about the 6-10 reset like last time she was in was 6 months ago. And she said, it was life-changing. She said, I couldn't do it while I was working, but now that I'm retired, wow, it has totally changed my life. It does make a difference. I've even had college students tell me, wow, it is life-changing. I'm doing so much better in school. I feel better. I have more energy. Yeah, it's good.
I want to say that Joe, the founder of Barton Publishing, he had mentioned something in a text to us too, I think the other day, about tracking maybe his heart rate variability. And he said the thing that makes the most impact on it is doing the 6-10 reset or 6-10-8. He said that's what gives him the best numbers, is when he does that. So very interesting.
So that's the way to lower stress. That's what I'm talking about. That's lowering stress, and that's your blood pressure is going to go down. Your blood sugar is going to go down. Your sleep is going to be better. It's good.
Good stuff. Okay. More questions here. So here we go, guys. Aubrey says, is a keto diet appropriate for a type 1 diabetic?
Okay. Excellent question. Thank you. Because most doctors will tell you, no, don't do a keto diet. But that's really short-sighted, because if you can manage your blood glucose, and now today it's so easy because you can get a continuous glucose monitor, especially if you have type 1, your insurance is going to cover it. And then you put your CGM on, and you can look on your phone where your blood sugar is all the time. And so you can totally do a ketogenic diet, and it's good for you. And why would it be good for you? Because you're not putting a bunch of sugar in your body. You're going to need less insulin because you're going to be less insulin resistant. So yeah, you could totally do that.
Okay. Terry's wondering, no, I'm sorry, Nikki, how much melatonin should you take?
Oh, good question. That's a very good question. Okay. Remember I told you melatonin is something that is like probably the only hormone that you can take as much as you want, and it's not going to shut off your gland, the pineal gland that makes it, right? So the dose is anywhere from 0.5 milligrams, which is what we usually use in people that have like in the nursing home, Alzheimer's disease. We usually start with 0.5 milligrams. And we usually end up around 1 milligram, but some people just do just fine with 0.5, and you don't need more than that. And more is not necessarily better, just enough. All the way up to, I have people with cancer who are doing 200 milligrams a day. So that's a very large dose, and I'm not recommending you do that. I'm just saying that's the breadth that this hormone can come in. So the usual amount is between 1 and 6 milligrams a day. That's somewhere in there is adequate.
Wow, that's good to know. I think one time I took 10 milligrams and I wasn't sure I was going to wake up. So I did it on accident.
You woke up dead.
Yeah, I did. I mean, I'm pretty sure I slept really well that night, but that's funny and good to know. Okay. More questions. So Delbert says, my doctor prescribed trazodone when I said I was not sleeping well. I haven't really taken it. What do you think about this medication?
Okay. So trazodone is another one of the antihistamines. It is a tricyclic antidepressant, and it primarily works on the histamine receptors to inhibit histamine so that you sleep. But there's something, it works differently than just like the normal Benadryl type antihistamines. And I've had people who have gone through a whole bunch of things. And I remember one guy ended up on trazodone. He goes, wow, I sleep great on trazodone. I go, but you don't sleep on Benadryl? He goes, no, it doesn't work for me. But trazodone did. So yeah, I don't know, it's something you could try, but again, it's the same issue as it's not a long-term solution. It does give you okay sleep. In other words, you get restful, restorative sleep, but if you're using it long-term, it's going to inhibit your acetylcholine too. So I don't
know. We have someone on here who says, I'm really trying to go to sleep by 10 and I have no problem falling asleep, but then I'm up at 1. So far, I'm not looking for something to eat.
Yeah. Okay. So this is a common problem. Thank you for asking that question, because it is a common problem. People go to bed early, so they go to bed at 10, and the first 4 hours, the 10 p.m. to 2 a.m. essentially is the time when the deep sleep comes in. And then a lot of people, they get their deep sleep and they've already had their restorative sleep. So then they wake up naturally. Everybody wakes up 5 times a night. That's normal. But we normally don't even remember waking up. We wake up and then go right back to sleep and don't even know it. Well, with some people, they get their restorative sleep. So they've had their deep sleep and they're done with their deep sleep. And so 1 o'clock, 2 o'clock in the morning, they wake up and they stay awake because now they're not tired anymore because they've already had their restorative sleep. And so it is an issue. And there's a book out about sleep, and it's very interesting. The history of sleep. It's fascinating. When somebody looked through, like, people don't usually write about the day-to-day stuff like sleep. You don't have people writing in their journals, okay, I slept 8 hours last night. They don't talk about, I went to bed at this time, woke up at this time. But they started finding, this researcher started finding that people would talk about the first sleep and the second sleep. And they're like, first sleep, second sleep, what does that mean exactly? And so they did further research and found out in the old days, when it got dark, you started making melatonin. You don't have artificial lights. You don't have any way of preventing melatonin from happening. No screens, no nothing. And so when it got dark, people started making melatonin and they got drowsy, and so they went to sleep. So they'd be asleep at 7, 8 o'clock, 9 o'clock at night. And then they'd go through this 4 or 5 hours and they'd wake up in the middle of the night and they weren't tired. So in between the first sleep and the second sleep, they found out things that people did. What did they do? Well, they'd wake up and light a candle and read a book. That was a common thing. But other people did a lot of mischief. They'd go and steal stuff from their neighbor, for example, in the dark of night, or that's when the farmer's daughter got pregnant, or the kinds of things that they would do in the middle of the night between the first sleep and second sleep. Well, what's the second sleep? Well, after you've been up for a couple hours, then you're kind of tired again. You go back to sleep and you wake up when the sun comes up, and that was a common kind of thing that people didn't talk about just because that's what everybody did. And so it was kind of interesting. So people that have that kind of an issue of I sleep and I wake up and then I'm not tired again, and I have trouble getting back to sleep. Okay. It's helped several of my patients to let them know, don't worry about it. It's okay to be awake for an hour or even 2 in the middle of the night. That's okay. And then get back to sleep. Oh, but I have to get up at 5 o'clock in the morning. And if I wake up and I'm awake for 2 hours, I only get 1 more hour of sleep. Yeah, that's an issue. And those are cases where I have had people take melatonin in the middle of the night, and that's been helpful. So you can either say, oh, if I don't have anything to do in the morning, fine, I'll just be awake for a couple hours in the middle of the night. Otherwise, you can try and get back to sleep, and even try some of the other things we're talking about.
All right. Someone had also said that they have the magnesium spray. Where on your body do you use it to help you?
Everywhere. You spray it on your arms, you spray it on your body, you spray it on your back, and then you just wipe it down. Yeah, because it's a more surface area. It's not amount, so you can't put a ton on your stomach and that's all. It's really surface area, so you want to kind of cover your body with it.
All right. Okay, so Rita's asking about. She says, "Is this good for diabetics? I eat small meals every 2 hours." This is something we talked about actually on our webinar yesterday.
Yeah, the diabetes webinar, we talked about that. Okay, the answer to your question is no. It's really not a good idea. Here's why. When every time you eat, you make insulin. And if you're eating, as the nutritionists say, 5 small meals a day with snacks in between, so you never have an empty stomach. What happens is you're constantly, so every time you eat, you make insulin. So what ends up happening is you fill your cells up with glucose because the insulin is putting sugar into your cells. And then the cells stop making insulin receptors because they say, we're full of sugar already. We don't need any more sugar. So they don't make insulin receptors. So then you get insulin resistance because of eating frequently. So eating frequently is not a good idea. The ideal metabolism is for you to eat, and then after eating, you use the glucose that was in your food, and then that will go away. Your stomach gets empty, and that goes away. You're no longer absorbing glucose, and then your body can switch to fat burning metabolism better, because the ideal way to be is 60% fat burning and 40% glucose. So you want to use only 40% glucose. People who eat frequently, because they make more insulin blocks you from using fat for energy. So they're going to do 60% glucose and 40% fat. And that's not healthy. That actually creates inflammation. So you don't want to do that. So eating frequently is not a good idea.
Ted said, concerning the 610 reset, is it better to eat breakfast at noon instead of 8 a.m.?
No, not for adrenal glands. Your adrenal glands actually do better if you eat in the morning and not in the afternoon or evening. So it would be better to eat breakfast at 8 and then eat your dinner at noon and then not eat after that. That would be a better way to do it.
Let's see. James says, I had a stent in 2014. Over time, echocardiogram and stress test showed good. No chest pain. However, I have no energy. Why?
Oh, that's a big one. I've had a lot of people tell me that after having a stent or a procedure that they have no energy. Okay. So energy comes from mitochondria, and if you're not getting enough oxygen, you're not going to have enough mitochondria. The stress hormones block you from converting your T4 to T3. So a thyroid hormone could be an issue. Another problem could be the adrenal glands. If you have excessive adrenal output, well, that's going to affect your thyroid too. But if your circadian rhythm isn't working well, that's an issue. There's also getting enough of certain nutrients are really helpful. And then exercise. If you don't go through the cardiac rehab program, where the physical therapist guides you through an exercise to increase your maximum cardiac output, then very often you don't restore that energy that would normally be there. So make sure exercise is a part of that. So exercise, nutrients, have your hormones checked, and that would be the cortisol and DHEA for the adrenal hormones, and then the thyroid hormones as well. And you kind of need the T4 and T3. A lot of doctors will only test the T4; they won't test the T3. So, but if you don't test the T3, you don't know if that conversion is being inhibited or not. So you kind of need the T3 to see that you're making the inactive T4 into the active T3.
A question here that asks, would the medication called memantine, will it cause your blood sugar to rise?
Yeah, it does. Yes, and it's supposed to. Let me look at that.
Okay. Again, guys, a reminder,
Yeah.
you can go to bartonwebinar.com, use code webinar25. That'll save you 25% on all of the things that you find there.
Yeah,
I think it's
memantine.
Or memantine.
Yeah. It's it's used for dementia, but I don't know. I don't know if it makes the blood pressure go up. I don't think it does. But no, I think it does. Yeah.
Okay. Let me just see here. What other questions I have? Maybe while you're looking at that. Good questions. I'm just going to ask another question if that's okay, Dr. Saunders.
That's fine.
Okay. My brother-in-law just had triple bypass surgery. Now he has leg and feet burning. Is a lidocaine patch or cold compress a good remedy? What would you suggest? So triple bypass, has leg and feet burning.
Okay. If it's both sides, it's a systemic problem. If it's one side, then it's an anatomical problem. So systemic meaning a chemical problem, or is it an anatomy? In other words, is it a lack of blood flow to one leg, or is it a neuropathy in both legs? Mm-hmm. So when it's both sides, it tends to be a neuropathy. And that means the nerves aren't functioning. And so you've got to get the nerves to function. And so the question of why is that happening? First of all, is it from poor circulation? Does he also have diabetes that can cause neuropathy? Is there a deficiency of something like coenzyme Q10 or vitamin B12 or folate, folic acid? Excuse me. Is there some kind of toxicity? So looking at the reasons why is why are the nerves dysfunctional, and then fixing the problem. So we have a supplement for diabetics called Nervala, and the Nervala has ALA, that's the ALA on the Nervala, alpha lipoic acid to help the nerves to regenerate. But if that's not your issue, that's not going to help. In other words, if you have poor circulation and you just start taking a pill, that may not address the problem. So finding out why is the best idea. So how do you do that? Well, ultrasounds of the leg are a good idea, looking at the blood flow, seeing if the arteries are functioning properly, if the veins are functioning properly. And then doing tests to see, do you have enough vitamin B12? Do you have enough folic acid? Do you have any toxicities like homocysteine? C-reactive protein will indicate if there's any inflammation. So looking at the blood tests, ultrasound, and finding out why that neuropathy is there, that would be the best place to start.
Okay, guys, we're out of time already. So Dr. Saunders, thank you so much. We'll see you next week. We appreciate it.
Okay.
And those of you who are watching on Facebook or YouTube, be sure to register for this webinar. It is free, bartonwebinar.com. We have 2 webinars that we do each week. We have one focused on type 2 and one focused on heart health. And so you can find both of those on that site. They are free. So tell a friend that you think might be interested in this as well. You'll also find a link to you'll find a link to our YouTube channel, and we have all of our past webinars posted there. And so be sure to check those out. Make sure you subscribe so you're notified anytime we upload a new webinar. I don't think we had a couple questions we weren't able to get to, or maybe a few more, but we'll be here next week and we'll do our best to answer those. Thank you guys so much for hanging out with us, and have a wonderful day. Bye-bye.